Hello. Have you been diagnosed with diabetes and maybe you had COVID-19, but you weren't really expecting to get a diagnosis of diabetes? It sort of took you by surprise because, hey, you thought you were healthy. So when your doctor said you have diabetes, it was really unexpected. I'm Dr. Hamilton Stubbs. I'm a double board certified sleep specialist and a certified nutrition specialist. I'm also a medical researcher and a medical missionary, and I love helping people understand some of the research findings that I come across, usually because I have been trying to help one of my patients or a friend. So, this is what I'm going to talk about today. Some people have had the misfortune of having COVID-19, but what they weren't expecting is to develop diabetes. Diabetes is a chronic medical condition that affects the endocrine system, specifically the pancreas. It's either a problem with not making enough insulin or the insulin that's on board is not being able to help glucose into the muscles or the body systems. So it manifests with a high blood sugar level. And over time, this can cause lots of damage to different body systems. It's thought to be a cause for memory loss, cataracts, causes proliferation of blood vessels in the eyes, which could lead to blindness, increases the risk of heart attacks, hardening of the artery, high blood pressure, gives you problems with your kidneys, and you can get some muscle wasting. People with diabetes are also at risk or greater risk of getting infections, and if they do become infected, severe infections. And this is what happens with COVID-19. Early in the pandemic, researchers saw a pattern. There were certain people who were more likely to become severely ill and or die if they became infected with SARS-CoV-2. Some of those were African Americans, people with comorbid conditions like diabetes, obesity, hypertension, autoimmune disorders, kidney disease, to name a few. So what is happening now is really not a surprise for people who've been studying coronaviruses. You see, back in the early 2000s, there was another virus in the coronavirus family that was causing problems around the world, but not a pandemic. That virus was causing severe acute respiratory syndrome, SARS. And the lessons that the researchers learned is that the virus affects the pancreas. And it does it by attaching to a receptor that allows it to get into the cell of the pancreas and damage that cell so that the pancreas is not able to produce insulin, which causes diabetes. Now, it's not limited to the pancreas. The damage happens wherever that receptor is, and it just so happens that the renin-angiotensin II receptor occurs in multiple organs throughout our bodies. So it can affect you in many different ways. But the one way that is surprising some of the people that I know is that it's causing diabetes. Now, diabetes is a condition where you really need to see your physician or your healthcare provider to confirm the diagnosis. But one of the ways that diabetes will manifest is as a sleep disruption. You see, when you have diabetes, you have to go to the bathroom a lot. And you may be waking up throughout the night just because you need to go to the bathroom. If this is new, this is something that you want to have checked out by your healthcare provider. Now, you want to make sure it's not because you have increased just your fluid load. So you may want to try to stop drinking fluids 90 minutes before bedtime unless you have some contraindication and your health provider has told you not to do that. because drinking fluids close to bedtime will make you have to get up and go to the bathroom. So cut back on those fluids, and if you find that you're still waking up to go to the bathroom, then it's you need to go see a health provider, especially if you have had COVID-19. Now here's the good news. There's some research to show that there's something in citrus fruit that offers protection to pancreatic cells and can mitigate some of the inflammatory process caused by coronavirus. I have found oranges to be a very tasty citrus fruit, and we did a challenge with that. If you want to find out about the next orange challenge so you can learn why I consider oranges a superfood, go to the link below, sign up, and get on the list, and I'll be happy to tell you about the next orange challenge. Thanks for watching me. If you haven't already, subscribe to my channel. I hope you will. And if you like this, give me a thumbs up, and I'll see you next time.